wanted it to be, but I think the microphones. So do please note, this isn't supposed to be a super formal event. We want to have feedback and discussion. We are using the mics because of, as I said, all of our online participants. So Jennifer, I think you are online with us. If you'd like to just say a few words on behalf of the global GBV AoR, and more specifically our member organizations, and we have quite a few of them in the room today. Over to you, Jennifer.
Thank you, and I'm sending you greetings from snowy Geneva. It's actually snowing out, which doesn't happen so often in Geneva. But I just want to say I'm really excited that this event is happening within the context of the 16 days. It's been made very clear. We all recognize and acknowledge that the women-led organizations are the ones who are the strength of the support in Sudan. And I think you have amazing representation here today, and it's so fortunate that that both organizations are represented in person, and I hope you'll have a chance to have more conversations. It sounds like they'll be around for this week. I myself was in Akiko's position for almost 6 years, a long time ago, when there was a terrible situation in Darfur, and it breaks my heart to see where Sudan is at today, and that there's been so little media attention. So I really encourage all of you in the region. I know everyone's working very hard on advocacy and getting the word out, and I think we all need to continue to really lift up the amazing work the women-led organizations are doing, but also do all of our advocacy collectively to get Sudan on the global agenda and get their revised HRP funded, because it is a really serious emergency, and we know that so much support is needed, and we know when things are no longer, when countries are no longer featured in the press, it's more difficult for them to find funding. So thank you all for coming. I can see from my view that the room is full. That's exciting. And I thank you all for taking time. I know at the end of the year, everyone's super busy. And yes, also good luck with all of your own activities for the 16 days. We know this region always does amazing things at the regional level. And a big thank you to both Akiko and Jessica for organizing this. Back to you. Thank you.
Thanks, Jennifer. Always great to hear your voice. Unfortunately, we weren't able to see your face, but your voice was ringing throughout the room. So we're happy that you were able to give us a few words. I think we'll go quickly over the agenda. Jennifer mentioned that HRP, the revised one, and Akiko's going to just spend a few minutes talking a little bit about the priorities for 2024 in Sudan within the GBV subsector. And a reminder that those priorities were developed by the implementing partners, who we mentioned are our frontline workers, which are the majority of whom are women-led organizations. I'm going to talk just a few minutes. October was Risk Mitigation Month for us in the Sudan program, and Alana is shaking her head as well. So I'm just going to talk a little bit about some of the results of our efforts in terms of risk mitigation, because we have partners here and online, and then also we have some donors joining us. And that's one of the key ways that we look at preventing GBV in a response. So you'll hear quite a bit about the response in terms of the HRP. I'm going to talk a little bit about prevention and what actually our other sector colleagues identified as key areas for intervention. And then we're going to lead to the next most important part of this discussion, which is with Shaza and Salwa. We'll then talk a little bit about the realities on the ground for those who are actually delivering services in these really complex, very complex environments. But before we do that, since we don't have so many people in the room, I think we'll just do a quick round of introductions so that we all know who we are. And then for those online, if you would like to put your name in the chat, that would be helpful. And for our online colleagues, I think we have about around 20. I see UNICEF is on there. We have some other UNHCR colleagues, some other donor counterpart colleagues also joining us online. We are really fortunate to have Kinana from the Sudan country office in the back monitoring the chat. So she, if you have questions and you're one of our online participants, please do write your questions in the chat. And then Kinana will keep coming back to you so that you can, summarize some of those questions, or if we need to have someone be unmuted, if you prefer to speak out, that's certainly welcome as well. So just to know, we're constantly going to be coming back to Kinana so we get equal participation with our online colleagues. As many of you probably know, this is a response that's also now spread out among 3 regions, both at UNFPA and I'm sure in many other partner organizations. So we have people from the West and Central Africa office covering Chad. And then we have our MENA office, our Middle East and North Africa office. And then of course our East and Southern Africa office, which also blends into the complexities of just coordinating this response a little bit. So without further ado, I think we'll do a quick round so that we can get to know who's in the room, since we do have people coming from different regions and countries. So maybe I'll start with you, Dominic.
Hello, I'm Dominic. I'm managing the Sudan Humanitarian Fund and SURF.
Hi, it's Jeanette from IFC. I'm the Global GBV Minimum Standard Specialist.
Good afternoon. This is me, Joma Mohammed. I'm the Program Management Specialist with USAID based in Khartoum, Sudan, but now joining that team here in Nairobi as Program Officer.
Good to have you with us.
Good afternoon, everyone. My name is Charles Stenger. I'm the GBV Information Management Specialist, Sudan, based in Nairobi. Thank you.
And you'll see that most of our Sudan team has been relocated, at least for the gender GBV portfolio, to Nairobi.
Hi everyone, I'm Sophie Marie, advisor at GSZ, working on a women's economic empowerment project in Eastern Sudan.
Kinana, External Relations and Reporting Analyst with UNFPA Sudan.
Hi, I'm Clémentine Kremer, Senior GBV Officer for UNHCR, the Regional Bureau based here.
Great. My name is Verona Phipps, and I'm a Senior Social Development Specialist with the World Bank, and I lead some of our operational work on GBV prevention and response programming.
Hello, everyone. My name is Awad. I'm the GBV Program Specialist and Head of GBV Unit for UNFPA Sudan Country Office.
Good afternoon, everybody. My name is Anna, and I'm one of the 3 TAs dedicated to Sudan from ECHO, the ECHO office.
Hi, everyone. My name is Anam Ahmed, and I am a Senior Program Officer with BHA Sudan, and I'm also in the Dartwood General.
Good afternoon. My name is Shazanat Madin Ahmed. I'm Executive Director for Middle Ansar Organization, which is one of the protection and GBV partner, and I'm based in Sudan.
Hello, everybody. My name is Salwa Salih. I'm the Director of WAD Organization based in Sudan, and I'm happy to be with you today.
Thank you. Good afternoon, everyone. My name is Hanif Tabani. I'm with the Canadian High Commission here in Nairobi, and I'm on the Pan-Africa and Regional Development Program. So we cover the continent from Nairobi.
Hi, everyone. My name is Yusukun, but everyone know me in Sudan by the name Tuki. I'm a Sudan Protection Sector Coordinator. Thank you.
Hello, everyone. I'm Edna Hamre. I'm the Deputy at the Norwegian Embassy in Khartoum, relocated to Nairobi. Nice to meet you.
Hello, good afternoon. I'm Ilona Stanley, Regional Protection and Accountability to Affected Population Advisor with WFP Regional Bureau in Nairobi. Thank you.
Good afternoon. I'm Leo Thomas. I'm with the British Office of Sudan, and I'm a Senior Social Development Advisor. And I lead on GBV issues for the mission.
Hello, everyone. My name is Mwajima. I'm a field GBV specialist covering the eastern part of Sudan. Is it on? No. Thank you.
Hello, everyone. My name is Hudar Abdullah. I'm a GBV field specialist for Sudan, UNFPA.
I know how to handle the
Okay, okay. I think then, since we are now running on time, we will keep this to 2 hours. Here at the Regional GBV Working Group for East and Southern Africa, we do like to keep our time and manage it. So without further ado, I think I will hand it over to Akiko to start us off with an overview.
So I will just give 5 minutes overview on we just developed 2024 human response plan just to show the magnitude of in terms of GBV. So in 2023, before the war, our PIN, people in need, was 3.1, including refugees. In May 2023, all the sector coordinators were asked to calculate the people in needs again. It has jumped up to 4.2. Now, as you can see here, it has again jumped up to 6.9. The main contributing factors are, of course, we have severely affected areas in Darfur states and Kordofan states always, and some parts of Eastern Sudan. But the northern and central part, including like Khartoum, they are severely affected. They are this color in these areas should be really pale, but you can see that it's really dark color right now. Our target population, because of the challenges with access, is 1.8 million. Before, in May 2023, it was 1.3 million, but again, it went up.
We just got word that the PowerPoint is not.
Oh, okay. Oh, okay, sure. Just a minute. Is it showing? Yeah, okay. Thank you so much. Yeah, sorry. Yes, so I just wanted to show this map. This shows the people in need increase in percentage comparison of, from original 2023 HLP that was developed before the war, and after the war, HLP 2024 that we are going to implement, in the coming year. So as you can see, in all states it is going up. In Darfur states, there's 150% increase. But bear in mind that they already had very high people in need even before the crisis. The striking numbers are here: White Nile states, northern states, Red Sea states. So these are the states we really did not have humanitarian GBV intervention before the crisis. So the PIN was extremely low. That's why we have this significant increase. But as you can imagine, we have limited GBV actors there. We have limited resources there, and then we have to suddenly activate, the GBV response there. And thanks to the national organizations who are really active on the ground, they quickly went to, expand their operation in these areas. And we see that, from the onset of the crisis, they are responding to, the needs in those states. Here, we have Shaza and Salwa, but, Nada and Wadi are really, some of them who really went to the front line in the beginning of the crisis. So that's why we really want to hear from them. What are your experiences going to these states where we did not have any presence in the past, and then quickly activate, train people, and operationalize the human GBV response? Yeah. Okay, now. Yeah, in terms of working, yeah. Okay, so just for our achievement, I just want to highlight that we really increase in the number of partners. So this is our 4W. We monitor, our activities by all GBV partners, in the country. You see the numbers of partner 41. This is actually the third in terms of operational partners in all sectors. Now we are a small, subsector, not even a sector. So I consider this as, really significant achievement. Many of them are national NGOs.
After the, the meeting, I can definitely share with you this link. This is interactive map. You can see all the organizations that are operational in Sudan, plus geographical coverage, and how many people reach in which activities. Can we go to the next slide? We're jumping to a women-led organization survey. Just a minute. Yeah. Okay. No, I think we can just use this now. Okay, so I just wanted to show this picture. Saza and Sawa is going to talk about this, but this is one of the women's center established in September this year in Janina town. So you can see, it's not even temporary space. UNFPA colleagues and partners, they really worked hard to establish the center in a static, in the building. There are, adolescent girls playing sports, women, doing economic empowerment activities. But a month later, this is how it looks like. So just to flag that, operational context is, even increasingly, challenging. But I also want to flag the resilience of the national partners. Some of the social workers who are working there, they lost all their family members. They were still on the ground, delivering services. Some fled to Chad, but they came back, they're displaced again. So I just want to highlight the incredible resilience in conflict affected states, particularly national partners. Yes, and this will be my last slide. The reason why I'm showing this slide is I often get the question, what is happening in Darfur? We have no presence of international partners. Anybody providing services? Answer is yes. So as you can see, this purple bar really shows the total number of services provided. People benefited from these types of services. Blue is Darfur states. You will be surprised that it's just 5 Darfur states out of 18. If you consider the population size, you'll be surprised that a lot of people are still receiving awareness raising. Many people reach with different GBV services. I am not saying this is enough, but it is really amazing that the continuation of services there. And we really think that the investment to local partners will be the key for sustaining services in conflict-affected states in particular. So this is really, really the brief overview of what's happening in Sudan. But later on, our colleagues from women organization will brief you more about details in what is actually happening on the ground. So back to you, Jessica. Thank you.
Yeah. Do we have any brief questions on this presentation? We'll have definitely a Q&A on the end, but if you have any clarifying questions, we don't want you to continue on through the hour. If you have any. Yeah, Verena.
Just a quick question on the type of services people are accessing, because it would be helpful to have some differentiation on the type of care that people are coming in seeking.
For this, so this is actually using the indicators from HLP. So for in HLP, because there will be too many indicators, and we already have many, we are not differentiating services, but the common types of services, of course, health, clinical management, rape, psychosocial support, counseling, counseling also includes remote and also in-person services, and also KGBV case management, and also referrals to other service providers. This is not limited to necessarily the GBV service providers. Some women may need, NFI assistance, some women need, really shelter, or, we are receiving requests for cross-state, I wouldn't say cross-border referral, but cross-state referral, between Darfur states, for instance, or, from Khartoum state to River Nile state or Jazeera state. So all these services are included in this category. Thank you.
Any other clarifying questions? Okay, I think we're going to talk a little bit about risk mitigation. And we do this because we often get asked, what are we doing in terms of prevention? And as Akiko mentioned, we have lots going on in terms of service provision with our partner organizations. And really in the onset of an emergency or even in a protracted crisis, many times a lot of our prevention work is linked to risk mitigation measures throughout other sectors. And so noting that, we did have a campaign in October that we reached out to all of the sectors, and we started with health, food security, and then shelter specifically, and WASH, I should say. So on those clusters, because we often see a high linkage of risk for GBV, along with service implementation around those sector-specific activities. So in October, we looked at it from two perspectives. One is how can we make sure that intersectoral colleagues know what to do if they encounter a GBV survivor or someone at risk? Because just like in our sector and others as well, we have a lot of local organizations doing frontline work. So as part of our safeguarding, but also PSEA work, prevention of sexual exploitation, and then just overall generally in prevention, we wanted to make sure that that was well understood. And so we often use a resource called our GBV Pocket Guide. And so we did have training, remote training, and we trained over 98 people, intersectoral, on those during a 2-training series. And then we went and did trainings, sector-specific trainings for those ones that I mentioned. And so we had over 200, the majority of whom were local partners, attend these trainings and really look at what are some of the risk factors that they're seeing in their work. And I think that's a key component to remember, is that we asked specifically those stakeholders who work in those technical areas to identify the GBV risks in their work. And we triangulate that, of course, with what we know from women's organizations. And then we also did our own analysis in April of 2023 through a series of assessments on the ground. And so I'm just going to walk through a little bit of this. The importance is, this is why we have so many intersectoral colleagues and donors with us, is to really understand this aspect. Because we can talk about it here in the GBV subsector, but putting it into practice takes more than us. And so that's why we're really excited to have so many people also joining us online who are directly linked, and also in this room, to making those decisions about risk mitigation. Next slide, Charles, thanks. So when we talk about shelter, and you'll see these are pictures actually that were taken during some of our safety audit exercises. Just going to let that picture sit. And so, of course, I mean, some of this is really obvious. This is currently the norm in many places in terms of collection centers and settlements in terms of shelter. And so we could talk about a lot of things just based on that picture, but what shelter actors identified as they believed GBV risks, and I think this is part of maybe the opportunity here, that they're also understanding the overcrowding obviously is a huge issue, particularly when we have lots of different family units living together. Many of whom don't know each other. And we also have female-headed households that are grouped into very chaotic spaces, which definitely creates a risk. Lighting or lack of lighting is a huge risk in terms of housing. As I mentioned, the privacy issue. And as we know, and I don't have to say this, I'm sure Shaz and Sawa, you'll also allude to this, even culturally, some of these practices are just not acceptable. And so it's forcing, and I'm going to use that word force because it really is the foundation of how we define gender-based violence. It's forcing women and girls into these untenable situations. And then we're also forcing, when we're looking at where women and girls are actually habitating, we have these inappropriate structures. So we have schoolhouses, we have other types of structures that just aren't facilitating this sense of security and safety. And so that's well known across many different groups. Maybe next slide, Charles. And then health. This was another area. The reason I said, again, that we focused on these specific clusters is because during that assessment exercise in April, many of our recipients or participants in female in focus group discussions identified and came out with these specifically. So we kind of did training around them. So in the health sector, primarily confidentiality was listed, can you imagine, as a risk factor for GBV. So that's not even about the service. It's about when they're accessing the service, the lack of confidentiality is putting them more at risk of GBV in the community and in their families. So that's not GBV necessarily, I think it's a form of GBV, but in the health center itself. Also, as you can see in this picture, we lack female healthcare providers who can provide those essential services. And I think this goes back to many of those cultural and social norms that Shaza and Sawa will talk about as well. But also it's a dignity issue. And we often don't link it. I mean, we throw that word around, dignity, but I think many of these risk factors that we speak about really do actually link to the lack of dignity in this response. And then, of course, I think this picture as well, which I think even Akiko took this picture, is in or one of our field staff. This is a common scene at a health center, and this doesn't discriminate. So you could be a GBV survivor receiving services in this, or you could be someone who is receiving services because you were in a car accident. So that's the problem, right? They're all receiving services in a room like this with those providers. And so when we talk about confidentiality, even if you did have a female care provider, if it's in a room that's overrun, such as this, and then also it brings us to this issue of privacy. So this is an access issue as well, because if women know that this is what they're going into, they're not going to access that service, even if we had the appropriate equipment and other things on the ground. I'm just going to spend, I think I also highlighted WASH, because I think WASH in many ways was universal. I'm going to say we probably got the most responses through our water, sanitation, and hygiene cluster. So I'm happy that we have UNICEF joining us on the line and did join us for this presentation when we were doing this series. I'm really happy that all of the sector specialists from global and regional level agreed that we needed to address this. So it's not in a silo, but we do need something, we do need to do something to mitigate it. This is a picture of a wash of the latrines in one of the settlement sites. And I'll just let that sit there for a minute. I mean, we can talk about locks and lights, but I mean, if it's made of old tarpaulin, I'm not even sure what, we have to even go further back, right? I mean, this isn't, in so many ways, this picture highlights, first of all, the safety and security issues, but then the lack of dignity. So no lights, certainly the number of facilities is substandard, even by SPHERE standards, we're not meeting them. The big issue, I think, an even bigger issue, is the separation by sex. As you see here, there's no clear separation between men and women. And what does that mean? It means that women don't use these toilets. Let's be clear. Even these exist, and you say, well, this is an emergency, Jessica, like this, we can do better than this. And so what it means is that women and girls are walking into unsafe areas to use the toilets, putting them further at risk. those that choose to use those toilets are also put at risk because men are using those toilets at the same time. And as you see the placement, it's not exactly in a crowded area where people feel safe necessarily walking. And I can even bring up the cultural norms of that as well, right? It's a circular issue here. I think the reason wash as well was one of our main sort of big areas of risk because of, you know, cultural and social norms. We know that women and girls are responsible for also, even in emergencies, fetching water. And so that came up as well as a point of risk, huge. And who's responsible for making sure women and girls are safe while they access a water point that was implemented by WASH actors? I'm just gonna lay that out there as well. Yeah, no one should face rape on their way to get a basic need such as water. And that's happening. And then lastly, again, sanitary materials also is putting women and particularly adolescent girls, which is their nuance, right? We often lump women and girls in one category, but we know in a crisis that they are nuanced. And so I'll specifically speak to adolescent girls as well, and their access to sanitary materials has a direct impact on their safety, but also in terms of decision-making. We're seeing lots of exploitation and other forms of GBV related to that. It's a security issue, but also a huge dignity issue. And so these were some of the results that came out. For the sake of time, I didn't necessarily focus so much on food security, but it was also looking at women as female-headed households was one of the risk factors that came out. The distribution points being overcrowded, and also the ability for women to carry those, the NFIs and other in the food items that they are given. And so they're having to then negotiate for their safety. And usually the only commodity they have is food. So by the time they get back to a shelter, they could have negotiated away 30% of their food ration for gatekeepers, transport, getting out of just even the distribution site. And so what should we do? I can tell you, and I'm happy we have also donors here joining us today, the GBV subsector is not getting funding for lights for toilets. We're not getting funding to build latrines that are safe for women and girls. And so we depend on our counterparts to be able to recognize proposals and then also even project interventions that actually this isn't going to be safe. And so we really have to think of what is the objective of this project. Is it to simply build the latrine, or is it to actually have people use it and access it? Because currently it's not in balance. And locks and lights aren't that expensive. A simple minor intervention could have a huge impact on the safety of women and girls. When you have a well project that doesn't take into account how women and girls are actually going to get to the well, if there's no community policing or protection mechanism built into that intervention, I can tell you for a fact that women are being targeted and raped on their way to get water. And we all can do simple interventions to mitigate that risk. I'm not asking you, I say this a lot, but if we can send people to Mars, we can figure out this water thing, right? And so I'm hoping, this is why I think it's really important that we have lots of other intersectoral people in the room as well, because this needs to be fixed. We need to get this right. Because the result is, and we know the result, which is women and girls are at huge risk of GBV and are now victims of GBV and most sexual violence. We haven't actually talked so much about intimate partner violence, but it's also linked because these are all considered roles that these women have to take on. So I'll leave us with that. Does anybody have any questions about our interventions or what you could do as well in terms of risk mitigation as a prevention mechanism and also as a response mechanism overall? Again, you can think on this because we will have a Q&A, but if you have any clarifying questions, I'd be happy to answer, or actually the experts in the room can as well. Good. That makes me feel good that everybody is understanding the importance of this issue. But I do want to say thank you to UNICEF and WFP and to some of our other partners who provided technical support during this October Risk Mitigation Month. So we recognize that we're not doing this in isolation, and so we're happy. And for those of you who are funding those posts at global level and regional level, they're helpful to us. So I'll turn it back over to, I think we're going to switch over now to really the most important part of our discussion today. Maybe is it Shazala or Salah, do you want to come up and talk a little bit about what you're doing?
Survey.
Oh, sorry.
Sorry, I will just, quickly introduce, this is like just, give a free, information for, before discussing directly with women-led organizations. So GBV subsector Sudan actually conducted women-led organization survey nationwide, targeting 41 organizations. So we have Arabic-speaking coordinators at subnational level. So they all work together to reach out, not just the organization that is reporting to 4W. We know that there are women-led organizations doing really important work in the field. So we reached out to these organizations, including community-based organizations. So this is in a nutshell, sorry, this is not really showing, but there are 41 organizations. And then, organization, we target specifically organizations working on GBV or gender equality. So 40 of them are working on GBV and gender equality. One was, working on something, related to GBV, production mandate, but not exactly on GBV. This is the, percentage of respondents by states. By the way, this report will be published in January. This is led by my colleague Nuha, who is a subnational coordinator. She herself was the first, one of the first co-coordinator for GBV AoR. She's from Yemen, from a women-led organization. So really, she's really the pioneer for, pushing, women-led organizations. And so she really came here to Sudan that she really wants to support this initiative specifically. And she led this, research. Thank you so much, Nuha, for leading this very important initiative. Okay, so one of the characteristics of a women-led organization is really women-led, and also the staff at the managerial level is and also operational level are female staff majority, and this is, I think, the striking difference between the national organization and women-led organization. I know that many of you went to the field, and usually the representative from national organization are male, managers are male. But for women-led organization, they are really empowering the leadership role of women, which our colleagues here will speak about it later. We also looked at when the organizations were established. So 71%, which is quite a lot, were established before the revolution. 22%, after the revolution, between 2019 to 2021, unfortunately, we had a coup. That time, open spaces opened up, so 22%. But there are new organizations, even like a new organization that was established after the war started. These are, mostly local, locally based, organizations. But there are 7% that are actually, established after 2022 in a very challenging time after the coup. So if you look at the size of the organization before the conflict and after the conflict, Majority, so you can see, I mean, like the biggest number, percentage is of course small, 5 to 15 staff. Current size of organization after the war, this is after the war on the right side, is, so you can see increasing. Medium is dropping, but there are some organizations that is, expanding in size. Large organization. As you can see, there are some organizations that are completely voluntarily, because they cannot access to the funding mechanism, or they have, challenges with operational capacity to make their organization bigger, or their nature of work is really focusing on community interventions. So this chart really shows that, how we remove this one, sorry, you're busy. Sorry, you cannot see the headline, but drop in budget. This is what we really wanted to know. And then, so you can imagine 90%, responded that there is a drop in budget. 37%, unfortunately, mentioned that there was a drop in budget, 50 to 100%. 100% meaning they are losing everything. And unfortunately, this is not really a rare case. Some of the organizations really lost all the assets. They cannot operate, therefore they cannot get the budget. And then they are, forced to work in a voluntary basis. But there are organizations, of course, still operating. Drop in budget, in the analysis report, we really like to, stick to these categories, the organization that was established before 2019, during the democratic transition and after the coup. So you can see, after the coup, there are, the size of the organizations are relatively small. So you see that the drop, percentage is quite small. But so you can see before 2021, between 2019 to 21, and before the revolution, so you can see there is a significant drop, particularly for the organization that has been operating for a long time, established before 2019. We also asked if they have received financing for humanitarian project. Only 37% of them said that it was accessible. 70% had some challenges. They could not apply, and some of them said that we applied, or or we did not. We applied, but it was not successful. And this, also we also asked the question: did you have to lay off staff due to the funding restrictions? 63% yes. Some of the voluntary, organization or community-based organization were running without funding, so they responded no, but that does not mean that they are receiving the salary. We will elaborate this, maybe perhaps in the presentation by Shaza and Salwa, but here are some of the challenges they face. Biggest, obstacle. What's interesting is, biggest obstacle, challenges mentioned here is lack of funding. But if you look at their needs later on, actually, this is not the biggest obstacle. So, you can guess, what is a priority for them. And of course, employees, family members, this is not unique to women in the organization only, but they're displaced. So they really have to restructure their service provision, modality, everything. And also lack of access to operation implementation areas. This is something we would really like to discuss, in the joint advocacy. And threats of violence, lack of such threats that women-led organizations are facing is really unspeakable. My colleagues here will talk about it later on. Okay, so I mentioned that funding is not the biggest need. So what is the biggest need? So as you can see here, give more support, opportunities, capacity building for women-led organizations. So what we see here really is that women-led organizations are not really asking only for funding, but they really want the operational capacity mechanism to be sustainable, to sustain themselves. And then, to provide continuous, provide services in continuous manner. Also, second one is, Yeah, and also training and awareness comes in next. And also, I mentioned that there is a bureaucratic obstacles and access challenges. Now, Shaza and Sawa is going to talk more in details, but they are really, despite all challenges, they're really trying to go to the hardest reach areas, really to address the most vulnerable. So this really shows that, in this area, we really need to, advocate together and provide more support to women-led organizations. And this is my last slide. So can you go back? Yeah. Okay. So yeah, we just can you move this bar down? So. Okay, so the last one is, we ask the question, how, all these statements, what is what is the statement that best describes how women-led organizations have influenced GBV response decision making? So this is something, we are still trying, it's in process. And, including them and strategic advisory group is, one of the steps that we have taken. Advocating for funding, we have half of them responding that they have been included. But so you can see, GBV planning engaged in humanitarian coordination platforms, and also, measuring the impact of the GBV response. We need more effort to engage women-led organizations. So we really look forward to welcome to, women-led organizations in strategic advisory groups so that we can better improve, our mechanism to, reflect women-led organization view in our coordination mechanism. Okay, so this is the end of the presentation for women-led organizations. We will just go straight to Salwa's presentation to talk more in details about the situation in Sudan, the success stories, and see also, they both have suggestions for how to make our interventions sustainable. So let us hand over the microphone to Salwa. Welcome. Okay, I will be here. Yeah. Ciao. Ciao.
Good afternoon. Maybe if I'm there, they give it to you. As you know, the situation in Sudan, the escalation GBV, which is spreading in the community. So, as women-led organization, driven by our mandate and driven by the willingness to help. So we decided to respond to the GBV Let me bring this closer. So we were confronted by many challenges. We were confronted by many challenges and obstacles, such as displacement of the staff. So we were scattered in many states in Sudan, but we could be able to manage that. Every one of our staff in the state where he is displaced will be our focal person there. This is how we overcome the scattering of the staff. And we also were confronted by some infrastructure problem like poor connectivity and poor networking. So we also could be able to overcome that by communicating through The Hague. I was in The Hague, so I take the message from one part to another part to keep the team on one page. And we have joined by new volunteers who don't have idea about GBV and C and this kind of concepts, but luckily in coordination with UNFPA Sudan Working Group, subsector group, we could be able to have a series of capacity building to get our team ready for the interventions. So in the community, we were faced by many obstacles, such as the absence of services, no health facilities, and also the bank system was not operating, inflation rate, corruption spread everywhere, and also many unpredictable issues appeared every day. And also we were confronted by the expectations of the stakeholders, the authorities, and also expectations of the communities. Because, you know, at that situation, they just need food or cash. And also for the authorities, they don't mind about what is gender-based violence. Just they ask you to serve food for the people. And in fact, they used to talk the talk, but they don't walk the walk. Like, it's not priority for them. It's not, they are, have to. And also the decision-making power in the community was a bit challenging. So we contacted some young imams to mobilize the community by preaching every day or every Friday. And also we asked them to talk about stereotyping the women-led organizations, because we are called women with stubborn heads. And also we asked them to ask the community to stop the rumors and the stereotyping of the women-led organization in the community. And so the leadership of the community is very important. You should know what they want, what they need, and the power relations in the community. One of the biggest challenges that we were working with zero budget, no access to the bank. All the bank system was just collapsed. And at the beginning, we were not recognized. So the recognition for what the women-led organizations are doing is very important to be recognized. It's not just about funding, it's about recognition. Success stories. I think something before the success. No, I think these. Invest in women. Yeah, there's another slide. No, these are the slides. Okay, anyhow, I can just talk. Funding. We need funding to operate, and also we need funding for, you know, investing in women-led organizations. In October, I was in New York, and we could be able to visit 3 missions, USA mission and France mission, to speak up about GBV, the spread of GBV in Sudan, and also to raise funds to stop GBV in Sudan. We met Susan Greenfield and the head of the mission of France and OSHA. So it's very important to invest in women-led organizations, and also to invest generally in women empowerment. Success stories in this complicated context. First of all, after struggling, we were accepted to work in the community and to provide services. We were heard and respected, and we spread the message to oppose GBV. And also, we could be able to do some kind of virtual services. And this one, I consider it as a success story, because in this context, it do help. So, you know, we were working virtually from different points, and also we could be able to provide a service to one district in Khartoum, which is completely, which is very dangerous. In that district, we have one of our focal persons. He's a young man. He could be able to walk to the women vendors on the streets who are forced to cook for the RSF, and they were, raping them repeatedly. So he could be able, in communication with one of our experts, to communicate with them what to do and how to get the service, and there is a clinic in the area. So also the doctor there was not well trained, so our expert could be able to explain to him the protocols of the GBV, and he could be able to provide service for many women in that very dangerous area, which is completely occupied by the RSF. So this is just part of our work, and I'm sorry today I'm just I'm sick. I hope it is clear. I think something is missing in the slides, but I don't know.
Yeah, okay.
No. Yeah, okay. What is needed, maybe?
Yeah, and also
Accountability and justice is, the two parties should be held accountable for their deeds. And also we need a kind of integrated services that, for example, we can't just provide a safe space and listen to the story, but I feel like it should be up to documenting the case, because also the survivors, they have their own expectations. So a kind of integrated services up to documentation should be developed. Thank you so much. I think I have saved some time to. We get more from Sheba.
We will wait until the end for questions. Sure, yeah. While Shaz is coming up though, do we have anything from online while we get Shaz up and?
Okay, so good afternoon, everybody. Again, my name is Shaz Ahmed. I'm the executive director for one of the local organizations called Nada Al-Azhar. And Nada is one of the protection partner who used to work in Sudan even before the war. And we are protection-oriented organization, so you will not see us in health or nutrition because we are lazy, so we focus only for one sector. But we really think that protection itself, it's a big response. So we focus on the 4 pillars of protection: general protection, gender-based violence, child protection, and mine action, and we are trying to keep it as integrated as possible. And NADA also are presenting the local organization within the strategic advisory group for the GBV, and within the advisory board for the Sudan Humanitarian Fund, which is managed by OCHA. So I just want to take you, before going to the point, I want to take you together, we can navigate through the GBV situation in Sudan, pre and during the conflict. I mean, all of us know that whenever we have conflict, we have subsequences and we have a result from conflict. But I think the scenario in Sudan is unique, and together we will see why it's unique and how we can address that unique situation. Challenges are many, but achievements also are there. So we will go through the challenges first, and then we will go for some achievements that, luckily enough, and with support of the UN colleagues, the subsector leads, and other partners, as well as donors, we make it happen in Sudan during this very bad time. So before April 15th, we as humanitarian actors still were facing some challenges, especially for women-led organizations working in the area of gender-based violence. And it's because of too many barriers, like sometimes it's political barriers, it's social barriers, it's cultural barriers. But all in all, we try to overcome it as much as we can. But when it came after April 15th, everything was upside down and the need were very big. And we have a high number of sexual exploitation and abuse. Many cases are reported in very short period, with new phenomena that men and boys are also explored to some sexual exploitation and abuse, which wasn't the case before the conflict, or at least it was not reported as it is now. On the other side, the situation is very fragile, and everything, as Salwa stated, there is health systems not working, there is no access to education, there is no access to livelihood. There is no access to legal aid, which is very important for survivors. So despite all that, and we have a very limited capacity when it came to GBV and referral pathways, and we have limited number of service providers, especially in hot zone areas, like Khartoum, Darfur, and Kordofan, as well as also we have like a very minimum knowledge on GBV issues, concerns, and risks in areas where the majority of IDPs moved. So for instance, according to OCHA reports, like 16% of the people displaced to Wad Madani in Jazeera, 15% displaced to White Nile, and I think 17% they displaced, 16 to 17% they displaced to River Nile and Northern State. And there are some states that didn't face any humanitarian issues, they're not familiarized with the humanitarian context, and this make the situation is more complicated. Also, we have the absence of the legal system. It's really worsened the situation of the survivors. It worsened the situation of the GBV survivor. And here I want to point and to really elaborate more on the impact of the absence of legal system, because it put us as women-led organization at risk, as well as it put the survivors at risk. For the survivors, they cannot access health services. They cannot access any right-based issue. For instance, if I'm raped by anybody and I'm pregnant, before pregnancy, if I want to go and to have the PIP kit or to receive the CMR services, I need to have a format from the police court, Article 8. And for instance, if the accident happened in Khartoum, where there is no presence for police authorities, then I cannot report that. So if I go to the hospital, as Salwa stated, the capacity of the people, the health cadre of the health staff is very limited when it came to GBV, and they can deny the services because they don't have Form 8. So if we, with the support of all partners, we manage to evacuate the survivor to another state where we have a police station or police services, this could happen after the 72 hours. So we cannot prevent anything. And for instance, if she becomes pregnant and she wants to make an abortion for this unwanted pregnancy, also this is not acceptable because she cannot do it unless she gets a decree from the court. Then when we take her to the court, then the court said the accident happened in Khartoum and the jurisdiction authority, geographical authority is not here in Wad Madani. So they reject to do that. So she keeps staying with the baby, and she cannot, even if she doesn't want, she cannot find a way to take a decision or to use her right in making the abortion for unwanted pregnancy. And for us as women-led organization, it also put us at risk with the communities themselves, because they think now we are like supporting girls to have illegal pregnancy and then or pregnancy out of marriage, because it's a cultural barriers, and then they can get rid of the unwanted pregnancy. It's mostly. So also it put us in a very critical situation, not only with communities, but also with the government authorities. Also, access of health care is continued to be very limited, and in some places it's completely lacked, and it hindered us from really providing a comprehensive GBV operation. So if we have a survivor and we take her to the nearest health facility and therapist is not there, CMR is not there, I mean, PIPKIT is not there. So it's really, sometimes we are very tight and we don't have any solutions. And this also put us in post-psychological, we raise the expectation of the survivor, but at the same time, even our teams, most of the time, they feel like they are really pulled down by like uncontrolled factors. So also, I believe in Sudan, what we are facing now is more and beyond our capacity, because now GBV cases, majority of SGBV survivor, they want to go across the board because of the stigma and the cultural barriers. So they want to go across the board. If she became a baby, she needs to go across the board because she don't want the baby to come among her tribe and her community. And then they don't have any other opportunity rather than to really talk to smugglers and traffickers. And now trafficking in person has become a very important issue. And that's why maybe Jessica and Akiko, when you spoke about the regional collaboration, now there are 3 regions, 3 regional offices are involved in Sudan operation. So I think cross-border also is very much needed to ensure that survivor will not be at higher risk, at heightened risk, and they can, if she is raped before and she's not pregnant, maybe she can get, or she is raped and pregnant and she's not HIV carrier, she could, so it's really very tricky and very, very unfortunate. I can switch from here. Okay, all of us know the reasons that increase the GBV accidents, and here I have a photo from North Darfur. Those ladies, they walk for 155 to 160 kilometers on foot, day and night, until they reach El Fasher. They come from areas from areas out of El Fasher until El Fasher, which is the capital city of Northern Darfur. Majority of them, they face sexual exploitation while they're on their way. Many of them, they deliver on their way to El Fasher, and all of them, they arrive to El Fasher only with the clothes that they have, and some of them, they don't have clothes. So it's really security situation for displacement, but limited humanitarian support. And when I'm saying limited humanitarian support, I'm not pointing to donors, because thank you very much for all our donors who are here in the room or who support the humanitarian work in Sudan, but also it's about Sudanese government because of the limitation of humanitarian access. I mean, humanitarian corridor should be open very quickly. It's unfortunate that yesterday also we have negotiations stop in Jeddah, so we don't know how we can achieve this humanitarian support. Also lack of awareness raising program. And again, it will take me back to the point that awareness raising now it's become not only a prevention, but also a response activity. And it's a really life-saving activity, because in some hosting communities, they're not familiar with the GBV issue, and they're complicating the response, not because they want to do so, but because really they don't understand the humanitarian context, and above and beyond, they don't understand the GBV risk and needs, and how can they address that. So what we did, I mean, in the middle of that dilemma and that
Seems there has been a connection issue in the room. I just informed them.
Thank you, Sheila.
Just a few seconds, they're working on it in the room.
You need to give me 2 more minutes. No, I'm kidding. I'm concluding. Yeah, so I already spoke about the challenges that we face as women-led organizations, but I want to highlight that sometimes the limited technical capacity among service providers, especially the government authority, could really make a major impact on our operation, like suspension of operation or stopping us from working and continue to work for GBV. Also, our female staff, and within the Azhar, we have 92% out of our staff. We have a 70 staff on fixed term contract, and we have 92% of them are females. So also now, yeah, and we continue that also after the war. So I mean, they are reallocated in different areas, but still they are there in the country and they're delivering. So the safety of our female staff is a major issue. And maybe I can continue without it, no worries. Yeah. So a way forward, I think we need to cooperate more and to work more to really activate the internal humanitarian law and GBV legislation. And we need also to have a well-established and well-coordinated, and I think my colleagues already mentioned the importance of having integrated programming and to have also like gender and protection to be mainstream all across the projects. Thank you very much.
Thank you, Shaza. I think we'll stop sharing screen now so that we can get the other colleagues, we can see them. We can also invest in our tech skills, clearly. Thank you. And Shaza, and maybe I'll start off with a question, Sawa, as well. You didn't mention so much, and maybe you can give some examples of also the security issues that your staff are facing. I think this is what moved me so much when we had our own discussion. Maybe Shaza, you could speak a little, or even Sawa, some of the incidences that your staff have encountered. So we're not even talking about the safety and security always of survivors and those at risk, but also delivering services. Maybe can you give us some insights on this?
Yes,
because some examples.
Yeah, thank you for reminding me. I mean, currently, there is a concern from both the staff, which is the military, and the RCF, which is the militia, or whoever the 2 parties. They have a concern that if anybody report a GBV case, that means we are pointed to them. So they're the one who did the action, and we want really to spoil their reputation, and really they're giving us hard time. So it's either like by threatening, sending messages and talking to some staff, but also like calling the staff to the national security offices and keep them from 8 a.m. to 5 p.m. without giving them food or water or allow them to pray or to go to the bathroom. They didn't ask them a single question. And if they didn't come in the morning, like our head of office in Haifa, she didn't come on daily basis from 8 a.m., they will not allow us to do the operation. So she need to report what we do, how we do it. And we are trying also now to really work also with these people and to make some awareness raising and advocacy among the staff. But the point is that the staff in place is not like a high rank staff.
At the same time, there is no series of command, like whoever is there in the chair, he's the one who's chairing everything. So when you go to for example, he's at locality level, if we go at the state level, they said, no, it's not our decision, it's from his mind. And there is abuse and sexual exploitation for the staff, and also corruption. Either you pay money, or you agree to do something that you don't like to do, or they will stop the operation. And now they stop us from doing the public campaign. But we also raise the issue, and we try also to explain to them, and they promise to be more flexible. But from that point until they change their mind, our staff had a tough time. And luckily enough, we have a psychologist among the team, because now they start also to do counseling to each other, because also they're under the trauma from the stress that they receive it from, relevant stakeholders. Apart from that, also we have threatening messages, which came to two of our staff, but we evacuate them from the area and we move them out to ensure that they will be safe. So it's not easy, but we try also to, but we have to work at the end of the day. We cannot leave people behind, so we have to do something.
Thanks, Shaza. And then maybe one follow-up question as well, while you're thinking of your questions. Sawa, what about, I know that your organization does a lot in terms of women, peace, and security, which is also in a way a prevention and a response. Can you tell us a little bit about what your organization is doing in terms of the women, peace, and security agenda?
Okay. In terms of women, peace, and security, we have been working on realizing the Sudan National Action Plan on UN Security Council Resolution 1325, because this resolution has 4 pillars. One of them is protection. So we integrate that in all our GBV activities, especially normally we segregate the beneficiaries, like the young women who are just didn't finish the university and it is closed, and in the age between 18 to 25 or 30. So we equip them by raising their awareness on 1325. And also we had a project from Women, Peace and Humanitarian Fund. The project was about track 2 in peace building, but we could be able to communicate with the secretariat to shift it, like protection and also humanitarian. So we introduced many needs. And that was also successful to have them in this area to get support. And I was also invited by them to highlight on that, on combining their work with the GBV and raising funds. And also we had a discussion on GBV on advocacy level. We could be able also to meet the working group, the NGO working group in New York, to talk about that.
Lots of tricks. I like it.
I hope it works, because sometimes just, I don't know, but I feel like
I think you have to do it though, right?
Yeah. We did it.
Your voice does, yeah.
And we explain many cases and many stories. We share some stories. We get authorization from the beneficiaries, and we share many stories
about what the reality is.
About what the reality
so important to
and about how the people look at it's GBV, the women bodies in Sudan now is becoming the battlefield. It happened that up to the area, if they have a fight in one area, they call it, I'm sorry, but they call it the Bantis fight. So after raping, they just carry the Banti and dance with it like this. We have to share this. It's terrible, but this is the reality. It's shameful, but this is the reality.
Yeah, thanks, Sawa. How about questions? Let's turn it over to questions. And I know, Kanana, you are monitoring online.
See a hand, is that a? Can I, we do have about, if you saw me on my phone, it was because I was also checking in with online and keeping time. So we do have about 20 minutes for questions. I started us off, but who else would like to, and if we have any online? I see some in the chat are reinforcing some of the messaging, which we appreciate, about the need for safety and security for our staff, and then also the issue of funding. And if you have questions about even risk mitigation or others. Yeah, right. Okay.
Thank you. I just had a question. I think it's more about risk mitigation and prevention, and the link between and nudging people's behaviour. I was aware the other week of the Feminist Peace Network meeting in Nairobi, and just how much of the conversation was reported to be around SGBV, and much more than the conversation about women's participation and potential political processes. So some of it raised this question of supporting survivors through trauma, and what type of optionality we have there in doing that in a safe way, and to the point that their voices can get in more formal settings too. The UK has had a really big emphasis on our preventing sexual violence initiative about survivors informing processes too. So that how could we be allies in terms of working through some of the psychosocial needs that there may be in the more immediate term, in a more collective way.
Okay, I'm going to turn that over to Akiko, and then if you want to also. Someone? The question is around psychosocial support, and in terms of how we're integrating that into the overall response, am I getting you right? And how we can advocate for more integrated psychosocial support?
Yeah, more collective way.
In a more collective way. Is that among other sectors as well? Or is that the risk mitigation part?
I guess we're thinking about it for ourselves also. We're thinking about ourselves in terms of that being, is that part of a process towards building women's voice to participate in that final kind of like political processes too, peace building processes.
I think that's a two-part then. Maybe Akiko, if you can talk a little bit about how our psychosocial support activities overall in terms of building resiliency towards recovery. And then maybe we'll also talk to Sawa, who's doing more peace building, and how we're engaging. As you mentioned, you had some women who were engaging in the process and speaking out about some of these issues. So maybe a two-part, Akiko, and then just.
Sure. So for psychosocial support, we are talking about not mental health, but psychosocial support. So this is integrated in our activities, particularly for, the community level activities at women, girls, safe spaces. This is, and also there's a group psychosocial support session, and also there's an individual session. And also psychosocial support, there are many ways of doing it, depending on the needs and acceptability of the community. What I hear is that, some organizations are doing some creative things like interactive theater, that, leads to, the healing, of the group of women in the community. So, the local actors are really consulting with the women, what is the best way? Maybe it's not straightforward, like, social worker, counselor talking to, like one individual, about particular experience. it really depends on the acceptability at, the particular community or like culture in that community. So that is how it is integrated, in our activities. But the thing is, like, we really, and also, of course, we, social workers, case managers, also when they follow up with them, they, provide social support, remote, counseling, psychosocial support. Right after the war, there was a group of counselors who set up the form-based counseling, system. And they disseminated these numbers. I think, Shada, you were involved in this, yes. And then, it was really widely used in particularly in Khartoum state. Helpline, unfortunately, it went dysfunctional right after the war. But we are trying to build, rebuild the helpline, though we are facing challenges, with bureaucratic impediment. So these are some of the types, but it's really a flexible way of really supporting women, since one fixed way of like supporting or like a counseling may not be the most suitable forms for women to receive this kind of support. So I will just hand over to Salwa and Ishada if you have something to add about more like a localized version, how it links to women, peace and security.
In all our activities about GBV, there is always a dimension of peace building and also dimension of social cohesion, because we understand the culture and we understand the real causes of such conflicts in our communities. So we use this concept and we try to combine them in our work, sometimes like cross-cutting issues and sometimes like direct activities in the community. And I would like to share also here, there is a risk even working with the IDPs, because now the conflict in Sudan is like shifted to ethnic conflict. So the IDPs themselves, they are ethnically divided, and some of them are affiliated to some militias. So combining GBV with peace building is a must, because the increase of GBV is related to the conflict. So we have to find a way to link, and we use some local modalities and local cultures to combine between GBV and our peace building and social cohesion. And also there is some combination of GBV and protection in 1325 in the National Action Plan. So we just try to realize all these issues on the ground. Thank you. I hope it is clear.
I got here. Yes. Maybe if you could reintroduce yourself for those online so they can.
I'm Ella Hammer from the Norwegian Embassy in Khartoum, relocated to Nairobi. I just want to start saying that I really admire the work that local organizations are doing under these very, very difficult circumstances. I have a question regarding the cross-border trafficking. I was wondering if you could elaborate a little bit more on that. We hear some alarming report also about trafficking from Port Sudan to Europe. I don't know whether you heard of that or if you could
so
information.
Yeah. Actually, that's why I said it's really need a cross-border and more international collaboration to ensure that this illegal immigration routes that recently started, it was there before the war, before the conflict, but now it's start to increase. And normally it was in the youth like a small young girls and boys, but now even elderly women and very young children, all of them, they are using smuggling and trafficking to really cross the border. And to be honest, all of them are coming to Cairo, but no one will stay in Cairo, because all of us, we know the living conditions in Cairo and access also to education and to medication, health, it's very restricted. If you don't have a stay permit, which you will struggle to have it. And then people are using now Egypt as a a transit area where they can go to the Mediterranean Sea and go to Europe. And the idea is that now the deal is started with the smugglers from Port Sudan to Italy. Okay, so the deal is like you pay this amount if you to arrive to Cairo, and you will pay this amount to be on the other continent. So I mean, also I feel like I spoke to colleagues from UNHCR, and I think we have some colleagues from UNHCR here, and because now all the people, they said if they enter into Cairo and they don't have any entry visa, legal entry visa, the next day they go to UNHCR and they will get the document from UNHCR, which is, I'm a lawyer by background, and I know from human rights perspective, I mean, they have the full, they can do so, but also to my understanding as humanitarian actor is really stimulate the appetite of people to move more. And now the people, they feel like whenever they enter to Cairo, the next day they go to UNHCR, they will take the car. So at least they feel like they're staying legally, although they came through illegal pathways. So we need also to do some awareness raising among the Sudanese here and across the border. In Halfa, we are doing that. We are doing a huge, we're putting huge efforts on really advocating to have awareness raising among especially among young people, to ensure them that this trip is not a pink trip. It's not a very nice and safe trip. So at least we let them know the dangerous and everything. And we do have a similar experience because we used to work with the Ethiopian and Eritrean refugees who are using Sudan as a transit. So we really have a technical capacity on really differentiating about people who want to stay and people who want to go. And we did like informal assessment, which we didn't share still. We will share it by the end of December from the border in Haifa. Like 90% of the people, they want to go to Europe. So, and the situation in Sudan is very drastic, so nobody will go back. So we have to be very careful on that and to try really to make a more collective efforts in stopping this illegal immigration. I hope I answered your question.
And just a note, the Regional GBV Working Group for East and Southern Africa, although we are focusing on East and Southern Africa, at our last meeting, we recognized the importance of this cross-border dimension. So we will be starting a task team that was on behalf of all the membership. We're really very keen on us doing that. So in the coming weeks, we will be also organizing with all of those receiving countries. So we can also do a similar exercise, maybe a webinar or something, or a discussion once we internally sort of understand those dynamics and what some of those risk factors are. So for those online as well, I think many of you are our members. So we will be, as the Regional GBV Working Group, also looking at, along with, as I'm sure everybody knows, the GBV AoR is specific to IDPs in host country or nationals, but then we do have UNHCR as part of our working group, of very active members. So we will look at those cross-border dimensions in more detail through the working group, as was requested by our members. Yeah, and I think you were there, Shaza, who was also like, please read this immediately.
Yeah, I just want to add the last point from my side. Also, the awareness raising, we need to have them timely, because this will become as a phenomenon. If it starts, it will never stop, even if we have all the measurements. So the momentum, we need to use the momentum. And again, Dominic is here, and thank you very much for the SHF, because we have the 48 response, which is the area based, which is specifically for Northern state protection, 1, 2, 3, according to the need. So the moment we conduct the need assessment, we share it with OCHA and with the subsector. Then in less than 1 week, we sign an agreement and we start to do the awareness. But if we delay doing the awareness, that means this phenomena will start and will never be in a position, neither us nor the government or the international community can really can make anything else. So the timely response also is very much needed.
And maybe, Dominic, I might put you on the spot since you just came back. Maybe you can talk a little bit about funding women-led organizations from a full fund perspective.
I'm asking you.
All right, on the SHF, so the HC is a big proponent of localization of women-led organizations of protection. It's in the HC vision statement for the SHF, and my team is trying its very best to achieve the targets that were set out by the HE. So women-led organizations, we're currently looking into a list of new national NGOs submitted by UN Women and the GBV sector, I understand, to see if they can become an SHF partner. Localization. I think we achieved a lot in that. We went from 13% a couple of years ago. We're now at 25% of our funds goes to national NGOs, and NADA is indeed one of our members, a very active SHF partner, and also Shaza is a member of the advisory board, so we're very happy to have her there. On our protection, we went from, if I remember well, 3 years ago, from 2% allocations to protection-specific activities to last year close to 30%. I think this year we'll land a bit lower at 16%. That's because all the other needs have been so extreme that we have to take them also in consideration. The previous years where we're at 25–30%, it was because we could really have these priorities there. But then when I talk about these amounts, which is around 10, 15 million, 18 million per year, depending on how much we get in contributions, it is protection-specific activities. So besides the cross-cutting approach that we have in our other sectors. How do we do that? Very quick here, because I can talk hours on this and I only have 5 minutes left maybe. And you're probably already all snoozing in after 2 hours of hard discussions. But we're really looking at area-based programming. Meaning that when we have funding and we want to do an allocation, we give an amount per state and we ask the people in the state to decide on which are the priorities and which localities and who are the best placed partners. And that approach gives us a lot better programming. It gives us the partners that are already active in the specific localities. But what I would like to invite the clusters, and not only the protection cluster, it's all the clusters, is to be active in the states itself. We do see weaknesses in area-based coordination. And I think a lot can be achieved by an active cluster by focusing on the presence and the reflection on what is needed in that state and giving that input in these meetings so SHF can do better programming there. One last thing is that we're also looking forward to in the coming years is, as we already invested quite a lot over the last years in protection, we can now look at how to improve these specific protection activities. We do see that while some actors, and I'll say NADA, for example, is very good in quality services in protection activities, sometimes we do wonder whether a women's center is well operated. There's maybe sometimes a focus too much on soap and cookies and a bit less on the real protection activities around it. So we hope that the protection clusters and sub-clusters, they can focus also on minimum standards, for example, specifically for Sudan, that we then as SHF can look at through the technical revision of the proposals and in our monitoring. Thank you.
Just very quickly, we have IRC in the room too, who's one of our member organizations, who's doing a lot just on those minimum standards. And I don't know, Jeanette, if you or Mercy wanted to say anything about the global project in looking at women's organizations and what they can do to support those minimum standards.
From 21 to 23 by now, the IRC is working with local and national women organizations in terms of making the GBV minimum standard accessible through different platforms, online and in person, and also some workshop. We are about to actually launch the learning and also the products that also follow in Arabic. We have digesting the GBV minimum standard in the easiest and user-friendly way, where it also can be offline and online. It can be in your mobile pocket, different way of engaging with a simple facilitation on some of the conversation that you can use with the team or with the community. So happy to follow up with you and make sure that it's also available to the Sudan context specifically. Thank you.
And just
just to add, beyond the global program at different country level, including Sudan, we are working, the IRC office is to support the women organizations that we are working into also actualizing or implementing or contextualizing the minimum standards to their context. So beyond the global training at country level, that's what we're looking at.
And I'm going to give it to Clementine and then back to Akiko, I think, to answer our last one. But while I'm walking over here, did you have your hand raised? Yeah, okay. The GBV AoR also globally has just received funding to look at quality of services being delivered through one-stop centers. So we are, it's all in coordination with our M&E toolkit. So it's a big project because you're also looking at our members' ability and capacities to deliver, but we have the funding now and that'll be launched in 2024. So just for everybody's noting, here in East and Southern Africa, we'll be launching that project. So look for our results, hopefully in six to 8 months. UNHCR, and then I'll turn it back to Akiko for our last question, and then maybe we can give it a close. Go ahead.
Thank you very much. I maybe just to give you an answer to the question you raised on Egypt. I don't work in Egypt, so I probably will have to get back to you on this. But I know the main issue that we have discussed is that to be able to get to enter Egypt since June, you need to have a valid documentation, so passport and visa. So many women and girls are stranded at the border. So I'm not quite sure what UNHCR is doing specifically, probably trying to avoid women and girls, staying at the border for too long, and of course, being at heightened risk of GBV. So maybe I can get back to you on the issue you raised. Maybe we can have a bilateral discussion afterwards. And I just wanted also to thank you so much for sharing your experience and the amazing work you do and your team in Sudan and the courage that you have. I also wanted to highlight my concern from the GBV safety audit results, and I would love to have those results, and if we can discuss also, and I can raise this to the appropriate colleagues. And it also shows to me that we have still a lot of work to do on ensuring GBV mainstreaming into sectors programming. We have all worked on this within our organizations, but I feel that we still have so much to do. And it also, to me, shows the dramatic level of underfunding this crisis has, and that's maybe a lot, and it's not much, but when you have so much to cover and no resources, and you have highlighted this, that you do so much with almost no budget. And so we are all in the same boat. So I'm addressing also this to donors present here that we get the additional funding. Thank you very much.
Thank you. I think, okay, Salah, and then we'll close with Akiko maybe answering some of those comments online. I don't see any other comments. Okay, we'll go from Salah. You have one. Okay, Salah, then Leo, then Akiko.
Want to link women participation, the decision making is the GBV, because all those ongoing peace negotiation, women are not represented, and also the GBV is not on the agenda because they don't want to be held accountable. So they look at it like unnecessary expensive, and they are hiding because the accountability is for for them. So this issue is not included in their agenda and women are not represented.
And when you're kidnapping and arresting the service providers who are working frontline, I mean, right, that speaks to a huge beyond accountability. I think Leah and then Anna, go ahead.
Thanks, Jessica. I think there was a point I was trying to make earlier that I think there's a direct link between GBV and also this exclusion in some of these political processes, and how can we, in a more thoughtful, systemic way, address that nexus there. The two questions that I briefly had was, what are our colleagues' thoughts or experiences in terms of being able to shift the behavior of these units, these troops, these people who are perpetuating SGBV? Because what I hear you saying at the moment is that the more we raise it, the more threat some of the workers come under. So what's the middle path, or what options do we have about still advocating for it without putting people in harm's way?
Question. Shaza, do you want to take that one? Let's quickly, and then Anna, you have to.
Yeah. Okay, thank you very much. I mean, we need to apply the twin track approach. We need to work on the existing structure and to ensure that we can deliver at the same time. We want to establish a new understanding among the people who's bringing the troublesome problem for the GBV actor. And sometimes, as I said, it could be from community, it could be from community, or it could be from authorities. So we keep advocating with the authorities using international communities like donors countries and also the UNs and others. And for the communities, we try to do like awareness raising and to invest more on educating and changing behavior of the communities and their response towards the GBV. At the same time, we are trying to soften the language and try to be a diplomatic in implementing the GBV operation. So we will not come and, as I said, we had an experience where we have the emergency room start to talk about LGBT while they're doing gender-based violence. So we need to have like a gender-sensitive, culture-sensitive, and conflict-sensitive programming, and to ensure that the messages will be disseminated in a very smooth way without confrontation with anyone, and to try our level best really to make the messages are very simple to the understanding of the people and our beneficiaries, as well as hosting communities and authorities. Thank you.
Okay. Which one should I read? I just wanted to say to Shaza, right, how frustrating that we have to simplify the language that rape is not okay. Yeah, but I get what you're saying. I know exactly what you're saying, but just the frustration.
About the awareness,
yeah,
messages, Sometimes in some contexts in Sudan, we used to put women empowerment as a title for a GBV project to make it happen.
Yeah.
So at least we can deliver. I mean, sometimes it's not like softening to dilute the content, but at least to make it acceptable to the level that we can do the proper GBV programming without harming the
Of course, yeah. But I'm frustrated on your behalf.
Yeah.
Okay, Anna, sorry. Sure, this is like my show.
No, it's okay. Maybe I just want to first start by highlighting our respect and admiration for those who work on these painful topics in the field. So particularly the women that are representing women-led organizations in this roundtable. And then I've had in mind throughout these couple of hours that we spent together, the issue of advocacy, which has now has come up, but with limited funding, as you were saying, and with a very complex context, then I think that advocacy becomes something that can have a very high impact. And this at various levels, right? So I think it was you who mentioned Form 8, and I was wondering whether that would be, this is a message that can be passed on to health services, health providers, relatively easily, saying, well, don't request for the Form 8. That's it, right? Simply, right? Yeah. Simply nothing is very simple in that context, but that could have a great impact. Advocacy can have a great impact. But that's at the field level, but also at a level where us as donors can sit in certain fora and pass certain messages, like that one that I was thinking of and Salwa mentioned, which is there's no woman in any of the peace talks. I mean, it's rare to see them all around the world in any peace talks, even though it's been proven that when women participate in peace talks, the peace deals are more sustainable, they last longer. So this has been, this is, of course, at another level, sort of advocacy, but I just wanted to emphasize the importance of first using us as a way of passing on certain messages directly to those that, that can actually change things. And also the other way around, right? To be able to have an impact in the field with certain things like this Form 8 and some other, high impact, relatively easy interventions or messages or, I think I'm gonna leave it at that.
Thank you. I'm gonna turn it, I think our last comment with Akiko, and I think Anna, you were also mentioned sort of that risk mitigation and the health component.
Sure.
And I'm thinking then also maybe we as a group at the GBV AoR can put together some of those top tier advocacy messages for everybody in the room, including donors, intersectoral, as one of the outputs of this event. So that's been actioned. I love action points as well.
Hi, Christine. Can you hear me? If I can come in, I'm not sure if I raised my hand and you didn't see. Apologies. It's hard to maneuver Zoom. If I can come in quickly as well, because I'm not sure if you see the screen.
Okay, please go ahead. Can you say where you're from as well?
Yes, so this is Rawa, a protection officer based in Cairo, working with IOM. I also missed the question on I believe in the northern states, so I just wanted to come in quickly because I dropped off in the middle and came back. I just flagged it on the chat that in terms of operations, we are operating in northern state, providing life-saving assistance, including medical support, PSS, and in-kind support, as well as supporting these local protection actors, some of which NADA is also part of, that are really the frontliners on the ground through this RRF mechanism that IOM has. However, the needs in that location are huge, particularly at the point of entries. Protection concerns are really, really huge and they continue to escalate. So there's a need for more actors in that area. I wanted to, before handing to Kiko, maybe something from the AoR that I also flagged in a GPC call in terms of cross-border coordination when it comes to protection monitoring, but also protection response. As IOM, we do, for example, there's women and girl-friendly spaces just right across the border for South Sudan. So we make sure whichever caseloads we have that they are referred, but I was wondering at a wider coordination level if the AORs have discussed with the AOR or the subcluster in Chad, in South Sudan, in Egypt, and there is coordination when it comes to protection monitoring, but also response. I think from the onset of this crisis, the cross-border mechanism has been quite undermined, of course, due to the huge needs on the ground in Sudan, but I think if survivors are not getting assistance in country, the least is for them once they cross to get assistance outside. So that's one question. And the other thing would be interesting to hear, as mentioned, on the risk mitigation assessment results, and if that has been shared with the other sectors, and what actions will be taken as a follow-up with that. Over. And sorry for just jumping in.
Rawa, can I jump in for 1 second just to follow up with Rawa? This is Jennifer Chase in Geneva. And I had put in the chat that IOM also supports on the issue of anti-trafficking and smuggling issues. So just to make sure you saw that, so you can follow up.
Right. So Thank you, Jennifer, for that. And just to reiterate that we are going to be addressing those cross-border dimensions through the Regional GBV Working Group. And Rawa, we're going to get in contact with you and others from all of those affected areas so that we know exactly what you're talking about, what the needs are, and how we can respond across regions. So please note, we didn't focus on that as much today because we knew that it's something that we are going to be addressing in the very, very near future. And we wanted to really focus on what was going on inside Sudan today, but that doesn't mean we don't recognize that there is a huge cross-border dimension. As I mentioned, this is going to be our last because we are trying to keep time. So our last comment, we had a couple questions about risk mitigation and some comments, which we appreciated. So Akiko, why don't you answer those questions and maybe take us out?
Sure. Sorry, I think, like I have many questions, so let me just try to be very brief. So for trafficking, Jennifer, thank you for raising this. I'm already in touch with the trafficking working group, particularly led by, our UNCR and IOM colleagues. Actually, I attended their meeting yesterday. We are really exploring that we can, insert some like concrete activities in 2024 work plan for the trafficking working groups, to how we can work together, particularly in prevention referral and also awareness raising. So it is ongoing. Even before the crisis, when we do the risk mitigation session, particularly in the eastern part of Sudan, this was always raised that, when they are trying to go fetch firewood, water, traffickers are, knows the route. They are waiting there to traffic women and girls. So this has been raised sometimes. So I am, a part of the trafficking group. For the risk mitigation piece, we have very concrete, thanks to Jessica, who led all the sessions. What Jessica really mentioned in GB risk mitigation session is something we can do, starting even tomorrow. It doesn't, something that doesn't require big budget. So we have concrete list of recommendations that came up from these sessions, and also the risks identified. And in addition to that, I saw in the comment there is a risk mitigation, like safety audit. Is it possible to conduct joint safety audit? Yes, of course. We are there. We have presence in 14 states. We are there to really support other sectors to make their humanitarian interventions as safe as possible. So we are there, and we try to also involve local organization, local women-led organization to reflect their voices in the humanitarian response and make the humanitarian response safer for women and girls. So this is ongoing. Yes, and also like for the joint assessment, we already conducted a couple of assessments, particularly with child protection subsector. We conducted at state level joint assessment. So we really want to expand this collaboration to other sectors as well. If I may speak just quickly, like 2 or 3 points for health sector response. Yes, there are recommendations that came up, but just to note that we now have national GBV SRH working group, and also at state level we have SRH working group as well. So that is functional. That is led jointly by Minister of Health and also UNFPA. I see that I share the invitation to GBV subsector members. Many of them are joining. So I see that some of the actors in the GBV subsectors have dual mandate, health and protection, including UNFPA. So I think they will really play the key role, particularly in the risk mitigation in health sector, and also they are the strong promoter of SRH and GBV integration. And this is really the key, really to improve the accessibility for women and girls. We see many life-threatening health consequences amongst GBV survivors. So, Shata mentioned unwanted pregnancy, HIV, STI, suicidal tendency, the need for mental health support, domestic violence with severe injury. These are all consequences of GBV, and they really need immediate access to health. So this is something we are prioritizing for next year as well. 2 points, sorry, I'm just going to wrap up. there is one actor that we did not discuss in this forum, and because I'm a GBV subsector, I'm a neutral coordinator, I'm going to mention the actor. Actor is the government. Now, the health ministry, federal health ministry, and also the state level, there are operational working with us. In terms of, the mapping of, CMR services, they are a strong partner, to cover the mapping of all states. UNFPA, health team in collaboration with Minister of Health is, conducting nationwide CMR service mapping quarterly, even before the war. So this has been practiced. It is ongoing, and I see that CMR focal point for Federal Minister of Health has not been changed, at least for 2 years since I came. Same for CBAL unit. They are active at state level. Same as the director is now in this place in white now, but she's continuing activities. She's trying to set up more units, in different states. And also just to highlight that according to the sector survey last year, more than 9% of healthcare providers belong to the government. 78% of GBV service providers, majority of them social workers, belong to the government. So the government cadre, service providers are really, the majority are really government. So we really, I know that modality of working with government is restricted, but this is something in the longer term we really need to consider and address. And the last but not least, our colleagues went to the field, and what we reported that there is a population group that we are, really, we really need to support more in addition to women and girls from reproductive age, that is elderly women. So dignity tickets we provide from the regional subsector, that's for women and girls in reproductive age, because it includes sanitary napkins. But, this specific group of population really falls, from from humanitarian assistance. So we really need to pay special attention because we often observe that they really have no belongings, no assistance, and limited access. Many of them have disabilities as well. So sorry, I just rushed through so many points, but this is really the points I wanted to add on to the amazing contribution from our colleagues. Thank you so much.
Thank you, Akiko. So thank you everyone for joining. On behalf of the Regional GBV Working Group for East and Southern Africa, along with my co-chair, Loreen Wasanga, who's online, and of course the GBV subsector in Sudan. Please look out for our advocacy brief that will come out as a result of this event. I think we've internalized what a lot of the questions are and the messaging. So we'll make sure that we create a document that's useful. Speaking of disability rights and access, the intersectionality, the GBV Working Group for East and Southern Africa, our next 16 Days of Activism event is tomorrow. We will be launching our GBV and disabilities fact sheet, along with the Regional Disabilities Working Group for East and Southern Africa. So if you would like to join us online for that, please do. We would love to see you online again. And thank you so much to Akiko, but most importantly, Shaza and Sawa for joining us today and sharing a little bit about your work. It still overwhelms me sometimes when I hear about the challenges that you're facing. So thank you for joining us, and thank you also for the team who came in for this event. It's very much appreciated. And to those who are joining us here in person, it's one of our few in-person events. And also to all of you online, thank you so much for joining us, and I hope you have a great afternoon. So thanks, everybody.